Lyme disease is a high-yield topic in that it's the most common tick-borne disease in the United States that is caused by the spirochetal infection by the Borrelia burgdorferi, which is transmitted by the Ixodes tick. And then there are three phases of the disease. In the early localized phase, the patient presents with the erythema migrans, which is a bull's eye rash with a central clearing. In the second phase, patients present with the cardiac and neurological abnormalities. So neurological abnormalities include like meningitis as well as the facial nerve palsy. And then the cardiac abnormalities include like cardiomyositis as well as AV node block. And then finally, in the third phase, patient presents with the arthritis of the large joints such as the knee. Now, there are different medications that can be used for the treatment of Lyme disease, and these include the doxycycline, which is used in the general population, amoxicillin, which is used in pregnant patients as well as in children less than 8 years of age, and finally we have ceftriaxone, which is used in patients with CNS as well as cardiac abnormalities. So doxycycline for general population, amoxicillin in pregnant patients, or in children less than 8 years of age. And the reason we don't use doxycycline is that it causes permanent staining of the teeth in children less than 8 years of age. And then finally, ceftriaxone in patients that have cardiac or neurological abnormalities. So here is an image of the erythema migrans, or a bullseye rash, and this is a high-yield image. And then here is an image of the Ixodes tick. Now here I've provided you with a memory aid to remember the details of Lyme disease. So here we have a burrito and a lime and an X written on the burrito. And all you will have to remember is that burrito goes for Borrelia burgdorferi, Lyme goes for Lyme disease, and then X goes for the transmission by the Ixodes tick, and then the treatments is doxycycline, amoxicillin, as well as ceftriaxone. I would also like you to note that the Ixodes tick, which transmits the Lyme disease, is the same vector for babesiosis as well as ehrlichiosis. So if a patient has Lyme disease, there is a possibility of co-infection with these agents, and thus there is a possibility of babesiosis and ehrlichiosis in this patient. And that concludes my discussion.